I'm Dr. Michael Latola.
And I'm Megan Strong.
A dentist writes in to confess her love for me and Amy.
Not sure who Amy is, but can a dentist save your life? Well, if you're a customer at Cheddar's Casual Cafe, maybe.
Amy's your evil twin, and customer service in the U.S. and worldwide has gotten so bad that people are now reporting they'd rather go to the dentist. Way to go, customer service.
Woo!
That's the kind of help we need. That and more on today's Chairside Live. Hello and welcome to episode 76 of Chairside Live. Megan, how are you?
I'm doing fantastic. Yesterday was my 2-year wedding anniversary.
Was it really?
It was.
And what did Brandon do for you?
Well, we went to our favorite restaurant in San Diego, Seersucker. And I know you're going to ask, did I have the Peter Cottontail? No. They had another cocktail that I decided to try, and it was like a Moscow Mule, but they used spiced, like cinnamon-infused rum instead of vodka.
Well, I'm guessing Peter Cottontail is just like around Easter.
No, it's all the time.
Oh, it is?
Yeah.
Oh, okay. Moscow Mule, I don't know. That always sounds like a drug smuggling term to me. Like, I don't know. Like, that's what you would call somebody. How did he end up in jail? Oh, he was a Moscow Mule. Right. He didn't drink one, but yeah.
Right.
And so how was your meal? Was it fantastic?
Oh my gosh. So good.
Seersucker liked this suit. And his other restaurants are Gingham, and they're all named after fabrics. Yeah, different clothing fabrics. Because seersucker might sound odd to the person at home wondering exactly what you said.
I'm sorry, but the restaurant is absolutely incredible, and we had a great time. It was really fun.
I haven't been to that one, but I've been to another one of his restaurants, and it was fabulous.
Yes.
Like your necklace.
Thank you.
I like that.
Bling, bling.
It really is. It looks nice. Well, we've got a wonderful show for you today. We've got an interesting case of the week. It actually kind of highlights one of the services, one of the things we do here at Glidewell that I still don't think most dentists know about. And if you look at it in terms of a cost-effective basis, because it doesn't cost all that much, and the fact that it really can lead to some great success when it comes to something we don't do a lot of, most of us, which is partial dentures, I think our design and treatment planning service for these restorations is fantastic. And I just happened to see my newly hired associate doing a partial denture the other day, and she had the design service sitting out on her desk, and I thought I'd grab it, bring it in, and share it with you. Let's take a look at that now. I happened to be walking through my own dental office the other day, and I noticed a case. Actually, this is one that my associate's doing, but it's a great service that we have here at the laboratory and probably doesn't get talked about often enough, and that's our design services, or our clinical support services, the illustrated product design. And it actually comes on the model as well. For any time you're planning, in this case, a partial denture, and that's mostly what it's for, or combination cases where we're going to have a couple crowns and bridges in addition to the partial denture. And it's really difficult. Most of us can't remember, say, the Kennedy classifications since we took state boards or national boards. I don't even remember what boards that was on, to be honest. And, you know, we don't really need to know that to be successful dentists. And that's what our people here at the lab know, is all those classifications and the names of everything and basically telling us what to do. So if you look, for example, we've got a pretty typical scenario here with the patient's missing molars bilaterally. And they've given us some suggestions about making this a more successful case. You know, we need a couple clinically prepared rests right here in between the two bicuspids. So we need a distal one in the first bi and a mesial one in the second bi. And then we need just one over here. We don't need two. There's no need to do two rests if one rest is going to be good enough. And they tell us they're going to put a couple Akers clasps, and they want some clinically prepared grooves for retention. I actually like the term clinically prepared undercut for retention a little bit better, and I'll show you what that's going to look like on the model in just a second as we do that. And so just by giving a little advice here on the paper and showing the doctor where the major and minor connectors and the clasps are going to be, it helps kind of demystify things a little bit. So let me move this and we'll take a look at that model. Pretty straightforward. But you'd be surprised how many dentists take an impression, send it in, and then we'll send them back the custom tray. Hopefully you're using a custom tray for a case like this. And then they will just take another impression in the custom tray and send it back without really having done any rest prep. So letting us show you where the rest prep should be is a good idea. Now, I know a lot of dentists were taught to use round burrs, for example, to make these rest preps, but we do see that they tend to come back kind of underprepared when a round burr is used. They'll be prepared enough for example, in the middle of the rest prep, but typically there'll be a lip right here. If you can imagine a round burr being pushed straight down into this tooth, at the deepest portion we're going to have enough reduction, but then on the edge towards the mesial portion of the tooth we probably won't. So it's probably better to use something like a 57 burr, but something that's rounded on the internal. So you could use something like that amalgam burr, that 257 we talked about, or even maybe a 1557. It doesn't need to be too rounded on the internal, certainly not as round as a round burr, but a fissure burr is a good way to go in and just prepare something that's going to have adequate thickness. If it's really thin here, we're not going to have enough strength on that metal for it to keep from breaking off, and we don't want the lab to build it thick enough so that it won't break, and now we have an occlusal problem when the patient bites down because those rests are too thick. So we'd like to keep it within enamel, of course. If we expose some dentin, I will typically continue and go a little bit deeper and then place composite over that dentin. I would rather have composite exposed to the oral environment than the dentin, obviously. Not a good idea to leave dentin unexposed like that, but I prefer to keep it within the enamel if possible. And then, of course, just carry that out with the fissure burr to the lingual so that minor connector is going to be able to go and fit up there. When you look at the palatal the major connector, you can see that this is large enough and comes anterior enough forwards where that's going to help keep the distal portions of this from rotating up. And as you'll see on the lower one, we actually have an indirect retainer, a couple of rest preps. And there might be a time where you would see, hey, that we need a rest prep here, or even on the cuspid. You could have a rest prep on the two cuspids or the two laterals with two little arms that come forward to help keep this from rotating forward when the patient chews on something sticky, for example. But here the designers feel that this strap is going to be wide enough and comes far enough anteriorly where that's not going to be an issue. You can see the patient's also got a diastema. That probably played a small role here. We want to keep metal, kind of away from the anterior anytime a patient's got a diastema, because you might be able to see that metal in there, and that'll make it kind of a failure as well. And as I mentioned, they also said they wanted a clinically prepared groove for retention, and they show where those are on the bicuspids. And so when you take a look at the model, you can see the little arrow, and they've drawn a portion of the clasp in, and they're saying, here's where we'd like a clinically prepared groove. Now, as I mentioned, they call it a groove, but it's really not a groove, not the way we traditionally use that term in dentistry. When I think of a groove, I think of a proximal box, for in dental school at least, like an amalgam, or even for a composite, and we're going to put some grooves in there. Or I think of grooves as something we might do with an 1170 burr and a crown prep on the buccal and lingual for anti-rotational purposes, where we're actually taking a burr and going and actually making a groove right into the tooth. Really what we're just trying to do here is create some undercut for that clasp to get stuck in. So you can take a small round burr. A number 2 might be a little small. A number 4 might be a little bit better. You could almost use a pointed burr, really almost anything you want, just to go in and remove a little tooth structure here. We're just trying to create some undercut. So when this Akers clasp comes around, it's going to sit in that undercut and help retain it in place. Anytime they survey these models and see that there's not adequate undercut, they're going to ask that you go in and remove a little tooth structure. And again, we're not looking for a groove, like this clasp is going to fit into this groove and we want it to snap into place in that groove. We're just looking to create some undercut for them so they can tuck the tip of that in there, not make it too apparent, when viewed from the facial when the patient smiles, but have enough undercut in here where it's going to help hold that in place and be part of the retention system to keep this partial from being dislodged. And then the same thing on the other side. Pretty typical on these bicuspids that they'll want us to develop some additional undercut here on the facial or the mesial facial for them to be able to tuck the tip of that Akers clasp into that space and know that it's going to hold well and we're not going to have to worry about retention in that area. Again, this is a pretty simple, straightforward case. Patient just missing lower molars. And the same type of thing that we're going to see here where they want us to do some occlusal arrests and they want some clinically prepared grooves or undercuts, as I like to call it, on one of the teeth over here, and then some dimple rests on the anterior teeth. This is probably easier to see on the model, so we'll take a look at that model. So on this one, you can see that we just have two occlusal rests that need to be done. We've got a rotated tooth over here, and so you can see that we're still going to put the rest in the same place. We're still going to put it into the mesial pit, up and over the mesial marginal ridge. But because the tooth is rotated clockwise, we're able to put it in that place and not have to worry about that lingual extension. The minor connector is going to come right up and go into that. As you might expect, because the tooth is rotated, we have a little bulge here at the distal marginal ridge. And if you look at what they wrote on the planning sheet, it actually says reduce. And so if we look at the model again, you can see where they want the doctor to come in and reduce it right there where that red line is. And so this is an area, because of that rotation, where we have too much undercut. It really is too bulbous in that area. And so to have something that's going to fit nice and tight down here, like the arm of that Acres clasp, it's going to be difficult to get out of there with that much undercut. And so again, we're going to come in here with something and just remove part of that. That's funny, because usually if this tooth was rotated correctly, that would be facing to the back, and that probably wouldn't be a major issue. So they're going to have us go in and recontour that. That's something that probably would not have occurred to most dentists, because we wouldn't have put it on a surveyor ourselves. You can see over here on this side we have an occlusal arrest just on that one tooth, not the other one. And this one they've actually prepared a little bit. They don't usually typically go in and prepare all of them unless it's out of the ordinary. And this one they just wanted to prepare and then colored in with red to make the point that, hey, when you put this rest in, make sure it's nice and open to the lingual here so we can get this minor connector up here. This is a different situation than if we had a rest preparation here and here, where you could just carry it up interproximally and then put our two rests here. Because we're just doing this one tooth, we want to make sure that this is open to the lingual. You can see the extent of the red ink over here showing you that this rest really does need to be opened up to the lingual so that minor connector can get up there. And of course, because of the size, as almost always happens, of the major connector down here, there's not a lot of area, and because of the vertical surface of the tissue back here, there's not a lot of area for sticky foods. When they lift up on the back of this partial, it's going to want to rotate forward. And that's the reason for these two dimple rests that you see here. And really all we need to do on these dimple rests is prepare something that's perpendicular to the long axis of the tooth. So you could take a 55 or a 56 burr and just come in and prepare a little shelf almost, if you will, in the enamel. You can see the sloping surface of those teeth. I mean, it continually slopes down. We just need a flat step somewhere that's prepared. So we're going to come in and make that little flat step right there so that when the metal engages that, it can't go any further. It literally can't go any further because of that vertical surface that we have on both of our cuspids there. I've seen dentists do like chevron rest preps where it kind of goes like that. But I'm just a fan of a simple, that's all I want is a dimple. They just want a flat spot right there, a plateau, if you will, that's going to be perpendicular to the long axis of the tooth so that when the metal hits it, there's a solid contact and it can't slide. So when the posterior segments, the free ends of the partial want to lift up and it tries to rotate forward, we have solid contact between the metal and that flat spot on the tooth so that it can't rotate or slide down at all when those minor connectors go up onto those two rest preps. So we've got the dimple rest preps there. And again, over here, they're going to have us go ahead and prepare a little undercut here. You can see the survey line and where they've drawn in the clasp. And again, we just want to create some undercut there where we don't have a lot of undercut now, just so we've got an area for that Acres clasp to really make some significant contact with and really resist being lifted out by anything, including the patient. We want something that's tight enough where they go to pop it out. They're going to have to work a little bit, and we don't want something that's going to shift around, obviously, while they're chewing as well. Over on the other side, we have enough undercut so that we don't need to do that. In fact, you might recall we have too much undercut, and that's why we're going to come in and actually remove a little of the tooth structure that's there. So it's a pretty straightforward partial case when you look at it. It's very typical. We're missing all the molars and everything else is there in place and is periodontally sound. A few teeth need some other work done on them. But a good example of how the design service team can go in there and show you exactly what to do, because if a dentist just took two final impressions without making any of those rest preparations or modifications, is there a chance those two partials would work? Yeah, there's a chance they would work, but they'd also, without these rests, without the room for them when the patient bites together, we'd have a lot of settling into the tissue and we'd have some retentive issues. Just these few little modifications that you're being asked to make oftentimes makes the difference between success and failure with a partial denture case.
Now let's go to a segment we call Show Us Your Tips. This week's tip comes to us from Dr. Marshall Horwitz, and he writes, Dear Dr. D, here's a great tip I would like to share with your Chairside Live viewers. I picked this up in a dental forum back in the days of the 2400 baud modem. I'm sure Megan is way too young to know what that is.
Yeah, you probably don't even recognize this sound.
Yes, I do. Dial up?
Yeah, that's what he's talking about.
Oh.
Very slow dial up, as a matter of fact.
Yikes. Okay. I use a pulp dent pick and stick on the occlusal surface of crowns to secure them while seating. That's not the tip. The tip of the week is that I put a little dab of Vaseline on the contacts of the crown with a disposable brush. Fill the crown with the cement of choice and then seat the crown with the pick and stick. The Vaseline helps the crown slide down and prevents the cement from getting interproximally. I realize that I'm probably the only dentist who inadvertently scuffs the adjacent teeth during a crown prep. The Vaseline prevents the bonding of a resin cement to the scuffed tooth surface. To speed cement removal of the cement subgingivally in the interproximal, I tie a little knot in the floss, and that knot catches the cement as I slide it through. So now I have Vaseline to prevent the cement from sticking to the adjacent teeth, and an easy way to remove the this I'm having a hard time. This is a long tip. Remove the subgingival cement. Saves time and aggravation. Best.
Well, Marshall, thank you for your lengthy tip. It's funny, you said that, and you are the only dentist who nicks the adjacent tooth. Oh, wait, no, you're the only dentist who admits nicking the adjacent tooth. Actually, I was just at a lecture with Gordon Christensen where Gordon said he nicks the adjacent tooth 9 out of 10 times. And so when you hear it coming from him, you know that we all do it. Anybody who ever takes a tour in the lab, I just randomly pick up models as we walk through the lab, and you can see that every adjacent tooth has been touched. The smart people either use an interproximal guard like that one from Ultradent, or they go in and polish it afterwards. But regardless, that's a great idea that you have about putting the Vaseline on the interproximal contacts to keep the cement from sticking to, a tooth that's been abraded, or even if it's been abraded and smooth, or even if it's not, even if you just have a regular contact, you can tell it's going to be a lot easier to remove any remaining cement because the Vaseline is going to take up some space so that you don't get the cement there. In fact, that's always been one of my complaints about resin-modified glass ionomer cements, is that they go from unset to pretty hard relatively quickly. And there's been times where my assistant will have a chunk that's stuck in between the teeth, and at that point, the floss no longer works. You've got a piece of cement that's now stuck in there that's bigger than either the openings, on either the lingual embrasure or the facial embrasure. And now I'm in there with a sickle scaler trying to push this thing out, and it is an absolute bloody mess. So that's part of the reason I switched over to Ceramer cement, because of the fact that it goes through a doughy stage and it's a lot easier to clean up. But I love your idea of putting the Vaseline on there. The knot in the floss is great too. I used that for a long time, and now I've gone to a product from Thornton. I used to use their 3-in-1 floss, but they now have a bridge and implant floss, which is essentially a floss threader on either side, so there's no regular floss. It's just that stiff blue floss threader on either side with that soft little caterpillar or pipe cleaner, whatever you want to call it, in the middle, and that does a great job of grabbing onto any excess subgingival cement as well. But I love the idea of the cement on the interproximal surfaces. You just have to make sure you don't reverse it and put the Vaseline on the inside of the crown and then the cement on the interproximal contacts, because that, of course, would not work very well. But I really appreciate you sharing that with us and giving us a chance to let our viewers know about it as well. That would certainly make you feel a little less nervous, maybe, about with a newer dental assistant, about walking out and leaving them to clean up the cement and getting huge chunks of cement in there. Or for any dental assistant, it would just be easier to remove. And so he's just talking about placing a little on there with like a cotton tip applicator or a little paintbrush, whatever it might be. So what does Marshall win for being selected for the Show Us Your Tip? Yeah, you can break that out if you want.
Well, here we go. How about, I'm sure your smile's already fabulous. But
We've
how
seen
about
Marshall's smile. It's pretty good.
the perfect smile, which looks exactly like this? We know Halloween's over, but I think this would be a big hit at parties.
We gave these away at the ADA show. This is actually what it did.
Woo!
Pretty cool. This is mine with the grill.
obviously.
The funny one, there's a couple funny ones. One is there's a couple without lips that are funny as well. There's baby teeth in there, so you put it in, you have like deciduous teeth. There's another one where you have, for lack of a better term, a porn stash that's on there, and this little
not okay.
a little soul patch underneath it, and it looks kind of goofy the more dressed up you are and things like that. So we started to give these away at the show, and they are actually big hits. So we're coming out with a whole variety of these. Marshall probably has everything we have to give away anyway, so this will be good and new for him. I want to start putting these in outgoing cases as well, because this would be fun for patients. And certainly some of my veneer, you have this one, which is actually the perfect smile. And I have sometimes where I'll put veneers on. I don't really like how I look. I'd like to be able to put this in the patient's mouth and they give them the mirror and say, what do you think?
Here you go.
And this is our version of a snap-on smile, I guess. It's like a suck-on smile.
Right.
And then it stays on. There's something to bite. You could probably make it all the way through a first date with one of these on without the other person knowing that your teeth are all rotting out and you've got advanced periodontal disease.
Yeah, maybe.
But maybe not.
Maybe, probably not.
Maybe us, maybe no. So anyway, Marshall, we've got those coming out to you. Very happy to have you be the first recipient of one of our new giveaway gifts on Chairside Live. Thank you very much. How are you set for viewer mail today?
We're set pretty well. Here we go. Are you ready for it?
I am ready.
All right.
I'm seated. Wait, we have an intro.
I know.
Okay.
So you're messing it up. Hold on. Now let's go to a segment we call Viewer Mail. This letter comes to us from Dr. Lisa Hogan, and she actually wrote to us through Facebook. Yes, and she writes, Dear Dr. D and Amy, now I'm going to let that slide because that's not my name.
No, technically it's not.
No.
No, if you're going to get right down to the letter of the law, if you're going to split hairs, yeah, that's not your name.
Right. So, Lisa, I'll let it slide this time, but my name is Micken. Okay.
She probably has a sister, a neighbor, a friend, a patient named Amy, and as she was typing on Facebook,
totally.
That's all it was.
Okay, let's hope so. I discovered Chairside Live a couple weeks ago, and I am addicted. All caps, so you know she means business.
Oh, I do. And there's no 12-step program, I regret to admit. You're stuck. You're addicted.
Here you are. I've learned so much from the cases, and I love to watch the witty rapport between the two of you. I mean, duh. I'm now a diehard Glidewell fan and will send all my cases your way. Thanks for the great education and entertainment.
Well, you're welcome, and hopefully the witty rapport, such as duh, will keep you coming back for more. And that's really nice. So there really wasn't a question. It was just a heap of praise being dumped on us. Well, that's what I'd like it to be every month. I'm getting tired of answering questions.
And no, that was really nice of her. And I, like I said, my ego was a little bruised by calling me the wrong name, but then it was followed up with such generous compliments that I'll choose to overlook it. But yeah, that was really nice of her.
If I had $1 for every time somebody got my name wrong, though,
I know
over the weeks, I'd have like $8.
Right.
And I'd buy you lunch.
No,
I'd buy you a burrito upstairs.
We've got viewer mail for you before that's been the wrong name.
Right. Never
Dr.
Amy.
T.
Right, Dr. T. Yo, I
Love
pity
that.
the fool who comes to me as a patient. Well, I want to send her a smile as well.
Yes.
Even though it's not the exact right name for you. I know a lot of Amy's.
Whatever. We'll send her that, and then I want to send her this as well. Because
I don't even know what that is.
Was
I doing the wave?
Really
I can't remember. Was I going around the stadium at the time?
No,
or,
I think actually at this moment you were just throwing your hands up in the air, so excited that I'm absolutely hilarious. And you told me my humor is improving, so that might have been a...
That is great.
Yeah.
I look possessed, though. I look like I've been hypnotized.
Why do you keep saying hypnotized?
I appear to be in a fugue state.
Okay. Oh my gosh! Breaking Bad!
Yeah, it's been over for like a month.
Okay, can you stop? You said fugue state. That's from Breaking Bad.
Right.
Don't ruin anything. I'm on season... I don't remember, but... I'm not on season 2. I'm on like season 4.
You're on season 3 of Cheers. You got a long way to go before you get all caught up with all your TV watching.
But Lisa, we will sign this for you. I will sign my name, Megan, and then he'll sign this for you.
I'll sign it, Amy.
Oh, please.
All right. Well, thanks for writing in, and again, we appreciate any false praise that you care to give us, and it will win you a prize. You got any news?
Of course.
Thank you.
A North Carolina dentist is a hero after he saved a choking teenager in a local restaurant. The dentist was enjoying dinner with his wife when the parents of the boy started screaming that he was choking. The dentist jumped up and performed the Heimlich maneuver. The choking boy has Down syndrome and a disorder that makes it difficult to swallow food. The parents were so very grateful and picked up the dentist's tab. The dentist was very humble about the whole thing and urges everyone to get trained in life-saving measures.
Wow, that's pretty phenomenal. That's I wish that should have been. I wish that was like nationwide news for all the bad stories about dentists.
Right.
Did they say what the restaurant?
Yes, it was at Cheddar's Casual Cafe.
Oh, Cheddar's. I don't think that's a national chain.
No, I think that's just North Carolina.
But he just happened to be eating there, and I've been on a plane before. When they make an announcement, we don't want to raise any alarm, but does there happen to be a doctor on board? And I'm like, well, technically I'm a doctor of dental surgery, but they're looking for a doctor, and what are the chances that they've got somebody up front in an emergency situation whose crown's high,
right.
And they need to come in and check it with some articulating paper, and so I'm never quite sure if I should raise my hand or not, and I'm not sure what I would do. It's been 2 years, since my CPR training, and we are trained how to do that, but to be able to snap into action like that, and really, if you look at CPR. That's somewhat complicated, but the Heimlich maneuver I don't think takes a lot of knowledge per se, besides where to put your hands and pull really hard. So almost anybody, I guess, could have got up at this choky cheese or cheddar cheese or whatever you said the name of it was. But I think it's fantastic that dentists finally are in the news for doing something great.
In a positive light. Yes.
Exactly, and I know he was very humble about it, but I'm a little upset they didn't do more than just pay for his meal at Cheddar Cheese Cafe or whatever it was called.
Right.
I mean, that was a great, a good $7 spent to save the life of your son. Yeah, don't want to put a price on his head, but we're going to buy your chicken pot pie or whatever he had and his fried pickles.
I actually love fried pickles.
I know, they're really good.
They're so good. No, but I mean, that was a nice gesture, of course, but you can't put a price. What do? Buy him a fruit basket? I don't think that really a gift is in order. I'm sure maybe they sent or I'd like to think that they sent, a handwritten thank you card or whatever, but I don't know. I think just picking up the tab is okay.
Do you think that's enough?
Well, I don't know. What kind of gift do you give? Thank you for saving my son's life. I don't know.
Here's our son. I don't know. I would buy a gift card so that the dentist could eat there once a week for the next year, maybe. I don't know. I would want to thank him more than once, kind of on an ongoing basis.
Okay. Well, hopefully then you choke and then I'll save your life.
I'm always hoping that you will choke, and I don't just mean reading the news stories. I mean, actually, with food. I'm always ready to push the desk back, run over, grab you in a bear hug, and pull as hard as I can and see what comes out.
That's not.
That's what the Heimlich maneuver is all about.
Okay.
I tell you what, next week on the show, we're going to practice on each other.
Nope.
You on me, and I'm going to lodge a piece of food towards the back of my throat. I won't actually be choking, but I'll give you, what the international sign for choking is? That's correct, yes. Well, you don't do it with that look on your face. Hey, everybody, look at me, I'm choking.
What do you do then?
Your eyes are bugging out.
What face did I do?
Something like that.
Okay.
But not really.
I thought it was dramatic.
There's stories about people throwing themselves on the back of a chair, too.
Yeah, because no one's around. That's what you're supposed to do.
The auto-Heimlich or the self-Heimlich
there you go.
maneuver. But I'm really proud of a dentist for doing that.
Yeah.
And we're all worried that, we're going to have to do some of this life-saving techniques in our office. I've only had 2 incidents that I can think of, and both times, very, very quickly, I called 911. Really, literally, the patient said, I don't feel that good. And I picked up the phone, called 911.
Oh, gosh.
And they said, no, I'm just a little tired. And so when the paramedics got there, we had to send him away.
Yeah.
But anytime we've had something like that, that's always the first, is have somebody call 911. We're not really well equipped to do it, but very cool to see a dentist do that. I'd like to send him something.
Yeah.
Let's get his name. Let's track him down. And
I have his name. It's through the story. So we'll.
Oh, do you really?
Yeah.
Let's send him a Starbucks gift card.
All right.
Or something
You're
else.
buying.
I am. I will buy for him. I'll send him a free crown.
Oh!
Free Brexer crown.
I like it.
We'll do that. And that's our guarantee to you from Glidewell Laboratories. Every dentist who can prove they have saved a life, 1 crown.
Yep.
See, I was all upset they just bought 1 meal. Now I'm giving a $99 crown for saving a life.
So
you can't put a price on someone's life.
There you go.
But it's $99, at least in the form of a Brexer crown. Anything else?
Yes. We know how prevalent dental phobias are, but it looks like people would rather sit in the dental chair than deal with customer service representatives. A new survey reveals that 1 in 6 consumers would rather visit the dentist than being on hold with customer service. Consumers become enraged with long hold times, having to repeat the same thing over and over again, and speaking to someone who doesn't know what they're talking about. But dental work isn't the only thing people would rather endure instead of customer service. Visiting the DMV, paying taxes, and going a month without sex made the list as well.
Wow, that's awesome that there's now, we used to be that, people would say things like, women would say, I'd rather give birth than be here at the dentist.
Right.
And of course the old standard reply was, let me know so I can adjust the chair. And that, was an old joke that my dad used to say. But people hate the dentist so much they would compare it to things like that. God bless outsourced customer service. Thank you, India and other countries, for making it such a miserable experience that now people, are going, wow, that's. I'd rather be at the dentist than be on this phone call. We're finally on the other side of the analogy, and it feels good. What was the one about going a month without sex?
Yeah, people would rather do that than have to be on hold or deal with customer service.
That's interesting. Mm-hmm. That's interesting if they would strike that bargain with you on the phone. It's, when you were trying to like you were having it, like you dropped your iPhone in the pool or something like that, and they said, well, a month with no sex and we'll give you a new phone. Not that Apple's bad, but just that's an interesting proposition.
It is. But when I was writing the story, I was thinking about it, and recently I was dealing with a cellular service, customer service on the phone, a provider, if you will, and I was about to pull my hair out. Mm-hmm. I was like, first of all, she made me wait forever, and that, whatever. But the lady, and that's fine, I understand. Lots of people are calling. She was so rude to me, and I almost was like, I'm going to ask for her supervisor and complain, but then I was like, wait, then is she going to write something bad on the call note and screw up my system or whatever? So I didn't do it. Kind of like the don't complain at the restaurant just to make sure they don't spit in your food sort of a thing. But I was like, it was so frustrating because why are you being rude to me?
Right.
And I did nothing. I was just asking her to clarify a question, and she was getting sassy with me. So I could understand people's hesitation to want to deal with customer service because it can be a nightmare. But not here at Glidewell Laboratories. We have some of the best customer service people around.
Customer service has become super frustrating, and I dealt with it the other day with some internet issues we were having, and I don't want to mention any names because I don't want to embarrass Time Warner Cable, but it was unbelievable. Everybody wanted me to go through the same series of diagnostic tests that I had already done with everybody, and I just started faking it. They say, let's go through this test. And I knew exactly what it was going to say. And very quickly I read back what it said and he goes, oh, that went through quick. And so I don't even feel like asking for the supervisor. I feel like she would have just taken off her headphones and given it to the person next to her.
Right.
Who knows if she even actually calls for her supervisor or not. That is one of the things about our lab, too, that Jim Glidewell has always been very, very strict about is we will never have an answering machine. No departments, or when you call, it doesn't say thank you for calling Glidewell plus 1 for Fix, 2 for Bruxer. It's always a human being. No Silicone Sally, as the term is known, and always want to make sure it's a human being that answers within 2 rings. And so that's something that we take very seriously. I can't see us ever outsourcing our customer care anywhere else. We have a huge building that takes up the entire 6th floor where it's just the people who are on the phones. But that is super frustrating, and it is one of the big annoying things with the modern world is having to deal with these kind of issues. It's one of the nice things about being at some of the elite levels with some of the airlines that I'm with because I travel so much. Because if you have just the regular 800 number, you can tell it's being outsourced, But if you're a Premier Gold member or whatever, when you call, you can hear just by the voice and you say, where are you? And they'll say, oh, Tucson, Arizona. And you're like, oh, thank God. You kiss the ground and be so glad that you've got somebody there who's probably not going to, but they could have attitude too, I suppose. But it's just great to hear that we're now on the other side of the analogy. People are saying things like, oh, customer service is so bad, I'd rather go to the dentist.
Yep.
Hell yeah, glad to hear that.
Hell yeah.
Well, that about wraps it up for this edition of Chairside Live. On behalf of everybody here at the laboratory, on behalf of Megan and the whole CSL crew, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time.
Hey now.
You're an all-star. Get your game on. Go play.
Welcome to the Megan Show.
What's up?
It's all Meg all the time.
All the time. I've been wanting to do that for
Really?
76 episodes.
Not the Crowded House Hey Now song?
I don't know what that is.
All right, that about wraps it up for
No,
this.
I got another story.
You do?
Yeah.